we will take that poll down. And our next presenter is John Su from iPill Dispenser. So John, how are you, John? It's nice to see you.
Good, Oren, how are you?
Good, good, thank you. Let's get you loaded up with the share screen and get you started.
Okay, sounds good.
You'll have 10 minutes to present and 5 minutes for questions. Again, anybody who has a question, feel free to leave it in the chat box. If we don't get to it during the presentation, we hopefully can get to it afterwards. Okay, John, I'm going to start the timer. You ready to go?
Sure. Hi, I'm Dr. John
Okay,
Su,
here we
CEO
go.
and co-founder of the iPill. Okay, I'm sorry. Thank you everyone for being here to see my pitch. I'm actually in Taiwan for the moment, so this is an international pitch. COVID has been very light here in Taiwan, and my grandson is being born, so that's kind of a nice reason to come to Taiwan. I'm the CEO and co-founder of the iPill. For 28 years, I practiced anesthesia and chronic pain management. I saw firsthand how opioid addiction affected the lives of my patients and their families. Patients would come early to get their opioid prescription and threaten me with a bad online review. If I didn't give them their renewal, they would really get angry at me in the office. There was no way for me to monitor medication adherence for abuse or diversion. With the COVID pandemic, opioid overdose deaths have increased from 50,000 to 81,000 people over the last year. I've stepped away from my medical practice to devote my full attention to combat the opioid crisis. The problem starts in your medicine cabinet. In hospitals and pharmacies, opioids are locked in vaults. At home, opioids are not locked up. Anyone has access. 1 in 4 opioid overdoses now involves children and teens. So the real problem is unsecured access to controlled substances of opioids. And that's because the DEA considers the pharmacy the end user of opioids. Without home opioid security, the opioid crisis has become a public health emergency. The consequences of abuse, sharing, addiction, and overdose are tragic. 80 to 90% of heroin and illegal fentanyl users report first abusing prescription opioids. And over 70% of prescription opioid abusers are obtained without a prescription. That's the major problem. There's no rules at home. Our solution is the iPill app. It is the iPill here. This is an actual working model. It is for secure storage, active control dispensing, and safe disposal of unused opioids. The iPill uses a mobile app as a key to operate a secure dispenser, the vault. The iPill app requires 2-point authentication, a fingerprint, and a personal code. Only the person prescribed has access at only the prescribed time. This reduces abuse. This is just like the hospital, just like an Omnicell, just like a Pyxis device, only it's in the home. The iPill dispenser is tamper resistant. It destroys unused pills on tampering and at prescription expiration. This reduces sharing, or what we call diversion. The iPill is a good idea that can save lives, and it's also a good business following a good business plan. The market is huge for the iPill. The serviceable addressable market is $5 billion a year. Everyone knows the opioid market is huge. We all know the opioid litigation that's occurring now. The business model is B2B. We have 3 market verticals. The first is dental practices, which represents about $250 million in annual sales for 10 million wisdom teeth extractions. The second is addiction treatment centers. They represent about $2.2 billion in annual sales from 3.7 million people in therapy. We already have 2 purchase orders. The third is pharmacy insurers, which represents about $6.75 billion in annual sales. We have traction. We have a small pilot planned with a consortium of 320 dental practices, which we hope to scale to all their locations. This could lead to $4.1 million in annual sales. Dentists are the second highest prescriber of opioids, and they have really been proactive in wanting to be a part of the solution to reduce opioid abuse and addiction in young people. We have 2 purchase orders, one from the Wheeler Addiction Clinic. They're in Connecticut. We have a small pilot planned in which we hope to scale up to their 13 clinics. The other is from Aspire 365. They have 3 state locations in 3 states, and they're expanding. These 2 purchase orders can lead to $7.8 million in annual sales. The addiction treatment centers see the iPill as a way to reduce the 91% relapse rate from current addiction treatment therapy and reduction of the transportation costs to get to a methadone clinic or Suboxone clinic. Finally, we're in discussions with a pharmacy insurer that dispenses 20 million opioid prescriptions per year. This represents a $1 billion sales opportunity. Pharmacies see a reduction in dispensing liability. We see the DOJ suing Walmart for contributing to the opioid crisis. Then we see a reduction in medical expenses improved by medication adherence, as VendRx does. There is no competition, but iPill has more unique features at less cost. This should make iPill a market leader. Most importantly, iPill will be the only dispenser with insurance reimbursement, and I'll talk about that in a moment. Our team is composed of serial entrepreneurs with exits. We have experts in pain, marketing, supply chain, and hardware. The retail price of the iPill is $25 a unit. At year 5, gross revenues reach $100 million, and our net income would be $14.8 million. This may seem low, but we have actually discounted the net income quite a bit because we feel that if we under promise and over produce, then we will be be a better company. In the sensitivity analysis, unit price and units sold would have the greatest negative effect on the bottom line. Reducing the COGS in operations would have the greatest positive effect. No one can copy the iPill because we have 3 granted US patents and 3 international PCT patents. We made a presentation to Health Canada because they have the second highest per capita opioid addiction rate in North America after the US. We are an FDA Class 1 breakthrough designated product. We are FDA Class 1 registered. Because we're a breakthrough designated product, this is important because on August 31, 2020, Medicare announced reimbursement coverage for FDA designated breakthrough products like the iPill. We're asking for $500,000 to set up manufacturing and to fulfill 2 purchase orders. This is to make a difference for the country, for the opioid crisis. We need angels who really want to make a social impact difference and make money at the same time. 73% of teens start opioid abuse from their own family medicine cabinet. We need to prevent our youth from a future of drug abuse, crime, unemployment, homelessness, and death. Thank you very much. And I'm open for questions.
All right, John, thank you. That was great. Let's go ahead and start some questions. Judges, do you have any questions for John? Judges? Well, we have a question from the audience. Oh, there you go. Chris, what do you got?
No, actually, so the very first question was the same question I had, is this is to prevent taking more than what you're prescribed. What prevents somebody from taking more pills or more pills out at any given time?
If you try to open the dispenser, the pills are destroyed. There's a DEA-approved solution. And then what happens to the pills, it forms a resin. Think of a bank ATM. It's very hard to break in, but if you break in, the money is sprayed with a dye. You can't use the money. You break into this dispenser, the pills are a hard marble. It looks the same as this going in as it does going out.
The question is not.
We are FDA.
The question is not breaking in, but once you open legally, you may take more than the one pill you're supposed to take.
Well, that's the point. You can't. If you try to break it, it destroys the pills upon opening within 30 seconds.
No, I don't break it. I open it with a fingerprint, everything on time, but then instead of taking one pill, I take 3 pills.
No, it doesn't do that. Dispensers.
See, the app requires, it has a clock on it. So the prescription is entered with the QR code on the bottom. The QR code puts a prescription into the app, and the app only works just like when you're in the hospital when the nurse gives you the medication.
But the question is, it just dispenses the dose at the time. You can't take out more than that, right?
That's correct. It's like a PCA pump, patient-controlled anesthesia pump.
Right.
Okay, now you answered. Okay, thank you.
Yeah, that's what I thought. So I have another question, and this is, I mean, I guess it's a consideration. I'm also an anesthesiologist. The powder, could someone theoretically use the powder from the pills if they destroyed it?
So that's why we have 2 ways to destroy: the DEA-approved solution and this resin. This resin is as hard as a marble.
Okay.
So you can chip it, break it. There's no absorption.
Okay. And then are these reusable?
They're not, because what's called the Drug Supply Chain Securities Act has to be disposable.
Right. And I don't mind that so much because your price point is so low. So, I mean, that to me is the biggest value. Like when I compare this to other technologies like we've listened to, I mean, the price point on this is very low. And, given the enormity of the problem, and I'm a dentist also, by the way, so I get it. I'm a DDS-MD. I mean, I really see the value of this because you've made the price point so low and the safety features in terms of the concerns of abuse. So, I commend you. This is really a great idea. I think we've spoken before, but I think this is great.
3 things to add for you. BD, which owns Pyxis, is now looking at us. Omnicell is looking at us. The people who are going to make the device, this device, is the people who are going to make my device, Foxconn. I'm talking to them on Monday. Somebody's asking me about payment. CMS is going to pay for this device because it's an FDA breakthrough device. That's one of our biggest advantages. We're the only dispenser that's covered by insurance.
Okay. Well, great. Are there any other questions? See, there's a...
Oren, really quickly, what is his unit cost? Yeah. Unit cost?
Retail?
No.
Retail is 25. COGS, 15. That's right now, without volume discounts. I'm making 600. That's why I'm here in Taiwan to talk to Foxconn. I'm going to build 600, put them out by the end of quarter 1 of 2021 or early quarter 2 of 2021. So Foxconn has told me that they can make this for $15 with volume discounts. I imagine it could get down to $8. I devised the product and bought product on Amazon. There's 3 moving parts inside. I designed it on AutoCAD to be ease of manufacturing. And anyone can break into a box. But if the box destroys the pills, there's no reason to break in.
One other clarification, Scary again. So in terms of the dispensing workflow, right? I mean, are you, and I may have missed this, are you envisioning that, so I get a prescription from my dentist, right? And I'm given, I don't know, one of the codeine preparations. And I mean, are these going to be pre-configured so that the pharmacy can dispense these or the provider can dispense these directly?
We're going to give it to the pharmacy. We've been talking to CVS Aetna. They have 10,000 pharmacies. There's 50,000 pharmacies in the United States. We want to give these devices to the pharmacy, not in the C2 safes, but we want to give it to them, have them do their process, and then drop it into the cartridge. This cartridge takes about between 20 to 30 seconds to fill. Actually auto counts the device and the pills inside. The app actually counts the pills as well. So we want the pharmacy to fill it, because if the patient starts to fill it, that defeats the whole purpose of sharing.
Well, no, I get that, but I
Okay,
was.
we're out of time, guys. Excuse me. Sorry to interrupt. We're over time, so I'm going to say thanks to John, and we can throw the poll up there, so we can get that get some scoring done. You know, John, one piece of feedback for me with respect to the presentation, it's very well done, but I think you should invest a little bit of money in a video. I think a video to show how the dispenser actually works would be worth its weight in gold, because it's confusing and specific.
I will put the
You don't have
video in
that
the
already.
chat. I will put
Oh,
the video
great.
in the chat, okay?
Perfect. Okay, so guys, we have our people, we have 30 seconds left to do the polling. And while we're doing that, Ari Brish can get set up with the PerifX presentation. We'll get started with that in just a moment or two. Okay, 10 seconds left. Okay, that's it. So just going to jot these down, and then we'll. Okay, terrific. Great job, John. Thank you very much.